Well, I just wanted to reiterate that I think that caffeine consumption in what we might call the moderate to low range, there's quite a bit of data about that to the extent that it's collected, measured appropriately in human pregnancy, and probably less data on high dose exposure to caffeine containing products. Certainly, coffee, tea, and cola, and no data on newer combination products or products that might contain caffeine and other ingredients as well. And that a really important time to consider measuring or better measurement of the effects of these exposure levels is in the window of time prior to pregnancy recognition. Which certainly is important in terms of fetal development. I don't know if it's possible, but I always push for improved methods of estimating exposure, both acute and chronic. And so, like Reagan says, maybe dietary recalls don't capture everything. Is there, some potential for developing technology that might, on a more continuous or at least repeated measures method throughout the course of a pregnancy or any period of time, better capture that information other than a very short snapshot. And I think also was brought up today that we know little about the health behaviors that surround caffeine consumption, particularly at high levels, and how those are associated with other risky behaviors. And in terms of what would be an approach to look at these, I'm always a proponent of cohort studies being the optimum way to deal with collecting this type of information as close to the time as the exposure actually occurs. Certainly in pregnancy, huge advantages, and the limitation is having to deal with needing large sample sizes. So certainly one of the major benefits of the design of the National Children's Study as originally proposed to be able to collect this kind of information on a very large sample of women and their children over the course of a pregnancy.